Hello friends. Today I'll give you a piece of knowledge regarding the history behind the birth of allopathic medicine through Unani medicine. Let's begin now. When you visit a doctor, you are stepping into a world of modern science. It is a world of lab tests, pharmaceuticals, and advanced surgical procedures. We call this allopathic medicine. But where did it all begin? To find the answer, we have to travel back in time. We must look to an ancient system of healing known as Unani medicine. The word Unani itself means Greek in Arabic. It is a tradition from ancient Greek physicians. For this, we have to think of Hippocrates. He lived over 2,400 years ago. His ideas laid the groundwork for a global medical tradition. He is the father of medicine today for both allopathic medicine and Unani medicine. Unani medicine is not just Greek. It is a synthesis of many cultures. How did these powerful ideas from the Middle East make their way to Europe? The story is one of translation and transmission. During the Islamic Golden Age, from the 8th to the 14th centuries, scholars from Baghdad and Damascus painstakingly translated ancient Greek medical texts into Arabic. These were the very texts largely lost to Europe after the fall of the Roman Empire. Works of Hippocrates and Galen were not just saved, studied, debated, and enriched with new knowledge. A lot of ideas, hypotheses of these knowledge regarding the Unani medicine began to seep back into Europe through key gateways. Spain and cities of Spain, Toledo and Cordoba. Then further Muslim scholars, Jewish scholars, and Christian scholars translated Arabic medical encyclopedias into Latin. So, what were the core ideas that European doctors learned from Unani texts? The most fundamental concept was the theory of the four humors. This idea, which originated with Hippocrates and was refined by Galen, formed the very foundation of Unani medicine. Blood phlegm, yellow bile, black bile. Each humor was associated with a specific element: air, water, fire, earth, and a particular quality: hot and moist, or cold and moist, or hot and dry, or cold and dry, or moderate temperament. A person's health depended on these four humors being in perfect balance. Every individual had a unique natural constitution or mizaj temperament. For example, sanguine, typically cheerful and optimistic. When Unani texts like Avicenna's canon of medicine arrived in Europe, they were treated like scripture. For centuries, European medical education consisted of little more than memorizing these ancient and medieval texts. Professors at universities in Padua, Paris, Bologna would literally read from Galen and Avicenna's books. There was very little questioning of the information. The authority of these texts was absolute. During the Renaissance, a new spirit of inquiry and direct observation started to take hold. Artists like Leonardo began performing dissections to better understand anatomy. One key figure was Andreas Vesalius. While teaching in Padua, he became frustrated with errors in the old texts when compared to bodies. He decided to trust the evidence of his own eyes over the writings of Galen. In 1543, Vesalius published De Humani Corporis Fabrica. This work corrected hundreds of errors passed down for over 1,000 years. Challenging ancient authority was a pivotal moment. Vesalius's insistence on anatomical accuracy paved the way for modern medicine. The scientific revolution that Vesalius helped ignite continued to gain momentum over the next few centuries. Thinkers like William Harvey discovered the circulation of blood in the 17th century. Harvey showed the body was more like a machine, with a heart that functions as a pump. This mechanical view was a radical departure from Unani holistic perspective. Science began to deconstruct the body into parts, organs, tissues, systems. This reductionist approach became the hallmark of the new Western medicine. The term allopathy was coined in the 19th century by Samuel Hahnemann. Hahnemann was the founder of homeopathy. Allos is Greek for opposite. Pathos means suffering. An allopathic doctor would give a patient with a fever a drug to lower their temperature, or give a patient with constipation a laxative. This was inherited from Unani's Ilaj bil Zidd. But the reasoning changed. It was no longer about balancing humors. It was about targeting specific physiological processes. The microscope and the rise of germ theory delivered the final blow to the humoral system. But Zakaria Razi has mentioned in his Kitab al-Hawi regarding the contagious diseases and their management. But yet more focus was given on immunity and thereby extensive use of immunomodulators in these conditions. Further, Louis Pasteur, Robert Koch, and others showed Many diseases were caused by tiny external invaders, bacteria, and viruses. This was a paradigm shift. That shift led to antibiotics and vaccines, the magic bullets. Modern allopathic medicine became very successful at treating acute infectious diseases and surgical emergencies. It often focused on the disease itself, isolating it from the patient's overall condition. Unani, on the other hand, remains holistic, focusing on the patient's unique constitution, diet, lifestyle, and emotional state. Its strength is often in managing chronic lifestyle-related conditions where balance is key. Despite differences, the family resemblance is undeniable. Taking a patient's history, performing a physical exam, and diagnosing before treatment, this clinical practice descends directly from Unani tradition. The idea of treating symptoms with their opposites comes directly from Unani's Ilaj Bilzid. Many modern drugs are derived from plants and herbs, first documented by Unani physicians. Breakthrough in the field of ophthalmology was also documented by Unani physician Ibn Hisham. Modern medicine is beginning to come full circle, combining precision science with lifestyle and personalized care. By acknowledging these roots, we can foster a more integrated approach to health. Unani medicine gave birth to foundational principles that, fused with scientific discovery, grew into modern allopathy. There is more to learn and explore regarding the Unani system of medicine. However, even today, treasures of Unani system in many diseases are untouched, which may give a major breakthrough in the diseases which are considered to be untreatable today. However, research for revalidation in various disease treatment is required. This is just a video on awareness about Unani medicine. Thanks for watching. For more videos like this, subscribe to my channel.